speech number 3, the demonstration speech. I'm going to be showing you all how to do proper CPR in case you get an emergency situation. I'm also at the end going to be showing the Heimlich maneuver just in case there's something lodged in the airway that you need to get out before you begin CPR. First off, before I get any volunteers to come up and help me out with the demonstration, I'm going to talk a little bit about the key factors of an emergency situation. CCC is a 3-letter acronym that you will need to know, check, call, then care. Check the patient, make sure he is okay, and if not, you call for help, and then you begin your CPR, your care. And then there's the ABCs, airway, breathing, and circulation. You check his airway. If his breathing is not doing well, you make sure that his airway is open. And then circulation, you make sure that there's proper, if the circulation goes hand in hand with the breathing because you need the airway open to get proper oxygen and blood to his heart. So Jerry, if you could go ahead and come up to the top of this table and we'll begin the demonstration. Okay, here we go. For an adult, you do 30 chest compressions, but if you don't know CPR, just stick with 100 compressions per minute. You get your bottom hand out, you put your top hand in between, ball up the bottom, and begin your CPR. You like to tighten up the elbows to give proper strength to the sternum, which will usually cause a crack in the sternum, but if not, there's cases where it doesn't happen and it still works properly. So we'll begin with 30 chest compressions, and for the sake of time, we'll cut it down to 10, 9, 10. Once you get through with your compressions, you come to the head, you tilt the head back for proper airway passage, and then you go ahead, you go mouth to mouth. In this situation, I'm not going to do that, but you go mouth to mouth, you give a deep breath into the patient, and make sure that the chest inflates. That's showing that there's proper air coming in through the throat. You do that for 1 second, and then you do another big deep breath, mouth to mouth, remember, mouth to mouth, and make sure that you get that chest inflation because that is reminding us that there's proper airflow into his heart. And then in this situation, you can continue your compressions for another 30 until help arrives. Now, if this was a toddler, a child would be the same technique, but for a toddler, we're going to use just 2 fingers right on the sternum and give nice hard compressions, but only 15 this time, not 30. After your compressions, you come back to the head and do the same technique that you used on the adult. Mouth to mouth, airways open, deep breath, chest inflation, and if it doesn't inflate, continue until it does because then that means there wasn't proper airflow on the first try. You do 1, mouth to mouth, again, chest inflation, and then you continue your CPR. All right, Jerry, now we're going to go ahead and move on to the Heimlich maneuver. Let's say you're at the pool, kids are playing, things get out of hand, he's eating a hot dog, and he's choking. Yeah, he's choking. You come up to him, you approach him from behind, you get your both hands, put them together, you go right above the stomach, under the chest, you give solid, hard jerks, but you got to make sure that you bring it up. Not just straight back, you got to come up. Once it is unlodged, then your patient is safe, everything is all good, and your job is done. And then I'm going to tell you a story about when I was in the ER. So luckily, the nurses were very, very welcoming of me, which you're not supposed to. I got on top of the bed and started the CPR. And usually when you do CPR in an area like a hospital, they'll have a AED, which is telling you to continue compressions harder or to slow down. But when the biggest nurse they had was on top of them, and the AED kept telling them, push harder, and my amateur self got on top, and the AED didn't say a thing. So that basically proved myself to those nurses that I knew what I was doing. That is my demonstration speech.